Hi, my name is Jinghua, a research fellow from Alice Lee Center for Nursing Studies. My typical workday including combination of research, preparing for the meetings, and teaching responsibilities. I spend time during the office writing my manuscript, prepare all the research projects and grant activities. In addition, I take a nursing tutor role, which is provide for student teaching and supporting the students' learning. To explain what I researched, let me tell you a story. Two men in their 60s living in Singapore, both with type 2 diabetes. However, one of them is quietly developing for thinking and memory issues. How should we predict the risk of cognitive impairment in this case? Now, instead of using a complicated medical system, I want to introduce for this risk stratification score, which we developed is a simple, practical, and usable in real life. From this risk stratification score, we only need to take for the blood pressure of the patient. We will take a physical examination test, which is testing for their balance, the physical strength, and the speed, working speed and as well as for the chair stand test, together with the cognitive test, which will only take about 10 to 15 minutes to complete the test. So no extensive brain scans, such as MRI, and no formal neuropsychological tests, such as the neuropsychological battery, which is time-consuming, takes about 1 to 2 hours to complete the test. Now what we found from this risk stratification score, which is provided a brief, simple but comprehensive risk stratification score to screen for those patients who is in their diabetes life, middle age and older adults to quick predict the risk of dementia. So this risk stratification score is useful for the real life setting. So we are not only predicting the rates of cognitive impairment, but also to provide the people with type 2 diabetes a chance to early intervene to prevent dementia and improve the quality of life. I'm also focused on the exercise and cognitive interventions for early prevention for dementia. Nowadays, I saw a lot of sedentary life in the office, in the middle age and older adults, so I personally feel that's so important to do exercise and intervene early for the early prevention for dementia. Personally, exercise is so important to me as well. So I like hiking with my family members, so I enjoy the timing spending with my family and doing the exercise, meanwhile to let me to relax, recharge and maintain the health balance. Looking back, the Healthy Longevity Program provided a valuable platform to connect with the fellow researchers and towards for the aging and healthy longevity, which broadened my understanding towards for translational research towards for aging trajectories along the middle age and older adults. You can find me in the linking by search my name or through the email. Thank you so much and see you again.